Let me move on to James Davis.
Thank you, Chair. Continuing on the theme of patient experience initially, Sir Simon, when the bill is published, do you believe that it should continue to allow patients to have the choice as to where they receive their care, both within the ICS and outside?
Yes, I do.
Excellent. And you think that will be forthcoming?
At the risk of repeating myself for a third time, yes, I do.
Excellent. Okay. In terms of the composition of the boards, clearly those who are appointed can drive the direction and success of that board. Do you think that guidance should be issued as to those appointments, whether executive members or others?
I do think that will make sense, but equally, we don't want to be too prescriptive, certainly not on the face of the bill, as to precisely what that composition should be, because, as I said a moment ago, the starting point here is that lots of parts of the country are now already working in this new way and have figured out the right kind of judgments for their local area. And this country is a diverse country with a different set of arrangements, challenges, partners in different parts of the country. And so trying to be completely vanilla, one size fits all on some of those governance questions would actually cut across what is already working well now in parts of the country. So a permissive framework with the ability through regulation for NHS England to set some guidance and at least make sure that there are the right guarantees in place locally, I think is the way to proceed. But again, I might just bring Amanda in here because she's been doing a lot of the thinking on this.
Yeah, thank you, Simon. I mean, I think that's quite right. We tried to suggest in our recommendations to government that we did we've just suggested absolutely the minimum that you would expect to see around that kind of governance table, both in terms of the ICS body and the relationship with the Health and Care Partnership. But we would absolutely expect, I think, to give people within that permissive framework some guidance. So one of the things that we are kind of really clear about, as you'd expect, is the importance of clinical leadership through the whole of the NHS, and that's as true for PCNs or individual organisations as it will be for ICSs. But I think we're just keen to steer away from trying to be over prescriptive about exactly what that's going to look like at local level, because as you say, there are some examples where things are actually working incredibly well now, and we don't want to stop people getting on and building on that success. But I think there will be a place for guidance just to make sure that, you know, we do have a minimum expectation set out.
Very good. And finally, from me, in terms of the standard of those appointed, should there be a reformed UK-wide fit and proper person register so that perhaps where there's been an individual who has been somewhat less than successful on one ICS board, for instance, they don't then pop up elsewhere in the country? So, Simon.
Yeah, I would say yes to that. And again, Amanda, in her capacity as Chief Executive of NHS Improvement, obviously oversees the current regime in respect of this and the CARC proposal. So Amanda, I'm sure, wants to comment on that as well.
Yeah, I mean, just to say, I think we really welcome the strengthening of the proposals around that. And I think it's something that I know this committee and the government have been very thoughtful about, and we're very supportive.
Thank you.